Hello, I'm Brian Moore, Communications Director for Newport News Shipbuilding. I'm joined by Drew Branch, our Director of Environmental Health, Safety, and Security, Newport News Shipbuilding President Jennifer Boykin, and Dr. Steve Apostoles, our Medical Director. Thanks everybody for being here. So I just want to point out that we are socially distancing ourselves following the 6-foot rule, less than 10 people in the room, and we're going to knock this out in 15 minutes or less. So all that said, it's a lot of logistics to work through. So to do this video, we're doing it. How do we translate that into building ships?
Clearly, there are parts of our shipbuilding business that are easier to accomplish social distancing than other parts. So let me just talk about the first part first. We have brought in over 11,000 laptops to make sure that the people who have a job that can work from home can work from home. We're still working through some logistics. We're bringing more in. We've taken time with our IT partners to open up the bandwidth so that people can log in and be effective. We've moved in major engineering buildings. We've moved leadership team and a number of folks on second shift to create more space. We're working on turning conference rooms and meeting spaces into office space so that for the people who come to work in those environments, we really can, we have a lot more options to enable the social distancing rules. So it's much easier to do that there. I was on the Washington and I was talking to two foremen in our piping department, and they were talking about while they're doing that in meeting environments, et cetera, some of the work that they accomplish, it's really not possible to do that. So what we're doing is we're providing to leadership team, and we're going to make this available to all of our employees because Drew's team and Doc Steve's team have really helped us pull and kind of coalesce what the CDC guidelines are. But we're working to sort of go through a series of does each job need to be an exception to that, and when it is an exception, the final thing that we want to ask are, do you have just as a matter of process, do you have any of the symptoms? Do you have a fever over 100.4? Have you been coughing? And ultimately, if we still have to do the work with a small team that's closer than 6 feet, we're working to limit their time together to less than 15 minutes, which I think Drew can really talk about why that's important, because that is key. It's a key part of the CDC's guidelines for protection.
All right, so Drew and Doctor, is there PPE that we're not even thinking about?
Absolutely. One of the things that we're working on with some of the leadership on the waterfront that has called us to say, we're struggling with this, how do we do it? You go back to your radiological principles of time, distance, and shielding. And it's the same kind of thing in protecting ourselves from the coronavirus. While the job may not require a respirator or a Jackson face shield, now might be the time to deploy it. You can also perhaps make a containment just a little bit bigger to give people a little more space. And we're working on those problems as they come up and people identify them to us. But the best thing we can do is be thinking about it, be socially responsible, speaking up when we don't feel well, and letting our coworkers know that, hey, I'm good for this job right now.
Right, and so when people are in that atmosphere and they're just doing their jobs and passing by each other and that kind of thing, I mean, what kind of suggestions do you have when they're just trying to even just walk down hallways?
Well, we have guidance from the CDC in that situation, Brian. You are not potentially at risk as long as you're not spending more than 15 minutes or not within 6 feet of someone. So just walking by is not a risk.
So let's talk a little bit about what's going on so we have liberal leave going on. We've got people working from home who can, but if people want to come to work, and especially if they're down in production, they have to be here to do those jobs. So what we did is we went to a site and we talked to some crew members practicing all of our social distancing guidelines, and we let them ask some questions of leadership, and we have some of those questions here for you to answer.
Why don't we just shut down for about 2 weeks or until completely everybody go home until this whole thing is maybe pass us by, and still get paid, but we're home and safe and we're not risking affecting others around us with this virus that's, is detrimental virus.
Okay, well, thank you, Ebony. The reality is, if you look at what's happening with the spread of the virus in the communities that we live and work in, we're still seeing cases rise. So part of the challenge is to help everyone understand, I'm not sure which 2 weeks we would select to shut down. I really believe what we have to do is make sure that we can work productively while the society continues to deal with this challenge. We've provided liberal leave because for each one of us, we have a different situation at home. We have different risks and challenges that we have to deal with. The schools are closed, so we have children at home in many cases. But the shipyard has to continue operating. I mean, even when we do shut down for Christmas, which I know are some of the other suggestions that we've seen, we still have to keep the shipyard operating. We have to keep the shipyard safe. We have to keep the ship safe. We have to work with the Navy on the ships that are here. But the bottom line really is if we're not working and producing shipbuilding product, just like any other business, we can't build the Navy, we can't get paid, and if we can't get paid, we can't pay the workforce. So keeping the business up and running and viable is also one of the most important things we can do for the safety of our workforce in terms of the security for them, their families.
Yeah, and Doctor, I think a good point about if we shut down, when would we do that? I know there's all kinds of models and peaks and valleys of this virus, but talk a little bit about that. How would you know when the best time would be?
This is a fluid situation. It's changing every day, but I don't think it's going away anytime soon. So I think it would be very difficult to pinpoint when you'd shut down because you might miss the curve. You might shut down too early or too late. So we're doing everything we can to minimize the risk.
And one of those things that we're doing is like the cleaning, and we're seeing a lot of that going on. Tell us a little bit about how that's going, where it's being done, that kind of thing.
One of the things that probably is a little bit difficult is we can't necessarily show all the cleaning that we're doing shipboard because it has some security implications, but cleaning shipboard is going on. We're cleaning time clocks, handrails, and also we're doing fogging and spraying of turnstiles of the handrails coming into the shipyard, common areas. We're cleaning in the engineering buildings and off campus. We are cleaning around the clock.
And so the cleaning is obviously incredibly important, and we also have shipbuilders who are worried about their health because they may be at high risk, they may have underlying medical conditions, or a family member at home that they don't want to bring anything home to. What are we doing about that?
Okay, yeah. So Brian, on a case-by-case basis, we've already moved hundreds of people who have notified their supervisor or HR that they have concerns and that they meet some of the at-risk conditions, which Doc Steve can talk about. We're paying attention to all the information that we're getting from CDC about what that population is. In some cases, we've been able to, change their work location so that they're isolated or, really able to practice the social distancing through their workday. Sometimes we've moved them at home. We've adjusted shifts so that, crews in certain areas have fewer people working in contact. And in some cases, when they meet the criteria, they're out of the yard, and we've been able to really protect them. So I would, we understand that trying to make that information more available to people is the challenge that we're working through right now. We know we need to make it easier and simpler for people to find that information. So we're right now working on our on the COVID hotline number, which has been posted, to leverage that tool so that if people are at risk, we can get them to the right people who can help them more easily.
And just to reiterate what those at-risk conditions are, the CDC guidelines state that if you're 65 years or older, you're immunosuppressed or immunocompromised in any way. And what that means is if you take a medication that can potentially immunosuppress your systems, significant heart disease, significant lung disease, asthma, and if you have a loved one that has any of those conditions, those are the people that are at higher risk.
All right, let's go to another question from one of our shipbuilders.
We still have, as foremen and management and stuff like that, we still have deadlines and things we got to hit. I have a module I have to ship out Friday that's going up to EB, And sometimes it's hard to plan your days. So if this continues in the future, is there going to be another channel, like a different type of liberal leave system where you still have people coming to work and you can still forecast the work you can get done?
So that's a good question, and what we're trying to do, because we know we're operating at a time when people are taking advantage of liberal leave, which is what we want, so they can take care of themselves and their families, but we're also trying to get work done so we can keep the business healthy as well, is to look at, are there different shift options? And we've had a lot of suggestions about that. Are there different shifts that we can do daily or during the week so that we can have a predictable sort of workload while practicing social distancing in the production environment for as long as that makes sense? So it is a good question. It is a challenge. It's a challenge that we have across the whole yard. And really, because we're not sure exactly how long this lasts, we're trying to figure out how we operate while the community is going through this.
And I think that's a good point for another question that we got from one of our shipbuilders, which we can take a look at here.
Everybody's wanting to know if we plan on shutting down or a partial shutdown if this coronavirus gets any worse.
I can tell you this, we have a plan. We have a plan for all scenarios. It's part of what we do with our crisis management team. While everyone doesn't see what's happening, there are teams all across this yard that are thinking through as many potential eventualities as you could imagine. It's what we do. So we do have a plan, but the reality again is that we're trying to figure out, while it makes sense, how we operate and under what conditions in our community while our community is still dealing with this. We don't know how long this is going to last. And we want to make sure that we have the business viable at the other end of this. We want to make sure that we have healthy shipbuilders who can come back to work at the other end of this, whatever that looks like and whenever that is.
In some ways, the coronavirus is not that unique. It's a lot like the regular flu that we get immunizations for every year. The vast majority of us will eventually be exposed to the coronavirus, and 30 to 50% of the people that are exposed will be completely asymptomatic. So what we're doing in the shipyard, we're doing everything we can to minimize risk.
Yeah, and I want to add to that because I appreciate what Doc Steve is saying. I mean, again, what the CDC says is that you're at risk of catching it from someone else if you've been less than 6 feet from that person for 15 minutes or greater. So we are doing everything we can to spread people out. We're doing everything we can to minimize the less than 15 minutes when we can't in certain production areas. We're doing everything we can to make sure as many people can work from home as possible because, we're always focused on the safety of our employees, and we're always focused on making sure that the business is here and is strong and is healthy for our employees to come back to. We're going to ride this out. We're going to make it to the other side, and what has to happen at that point is production jobs to build the nation's national defense asset. That's why we are part of the critical infrastructure. So I just appreciate what everyone is doing to help us get through this.
All right, so we're getting close to our 15 minutes. So I just wanted to end that there's so much information and misinformation out there. But what do you recommend, Drew, for folks that are just trying to find the latest?
I absolutely recommend going to the CDC website. It's straightforward, it's easy to read, it divides topics up by whether or not you're high risk, it divides it up by your family, it divides it up by your workplace, and it's straightforward, it's simple, it's easy to follow.
All right. Thank you all again very much. Make sure that you get all the latest information from our 411 website. There you'll find everything from pay and benefits guidance to leave time options and wellness information. We've also added information and maps on where cases have been confirmed at Newport News Shipbuilding, along with links to Virginia and North Carolina maps with confirmed cases. In addition to the 411 website, we also have the COVID-19 hotline as well as the COVID-19 email address where you can get your questions answered. And make sure you download our app, NNS To Go. Thank you so much. I'm Brian Moore.